Hi, this is Dr. Behnam. I'm a board-certified dermatologist. Today we are going to be doing another stem cell therapy for hair loss on the scalp. And we are joined by one of our lovely patients today who came down to see us today. We have already drawn his blood and we are doing PRP in the next room, which we're going to go and take a look how that's going. So welcome. May I actually show your scalp as possible? So this is the area where we're going to be focusing on, basically right here. He's just thinning out in this area. I've already drawn a line. What we're going to be doing right now, we're actually going to numb it in a circular fashion. And when we numb it, he's not going to feel any of the picks and any of the pokes basically that we're going to do while we're doing the stem cell therapy. So we're injecting lidocaine, and what we do in a circular fashion. And by doing this in a circular fashion, it numbs everything within the circle. So when I do the stem cells, you're really not going to feel it. That's the whole beauty of it.
Sounds good.
Most places do not numb at all. They just put topical numbing. But honestly, I feel that numbing is probably the best way of doing. Can I have the next syringe, please? Excellent. Okay, I'm just gonna clean you up, and we're gonna go to the other room. So here we go. So we already got the blood, and we already spun it once, and we are going to take it out of the centrifuge right now. So this is after the first spin, and what we're going to do is remove basically the yellow part, and we're gonna centrifuge that again. We're going to open up the fun part of this process, which is the stem cells. And when you open this, so one thing you're going to see is dry ice. A lot of dry ice. So what we do, we're going to dump this dry ice right here. And you will see that the stem cells are all the way basically in there. So when we're ready, what we do, we're going to take the stem cell out, we're going to thaw it, and the trick is as soon as you thaw it, you're going to be ready to inject that thing, typically about 10 to 15 minutes, but we typically do it within like a minute or two. Just really inject it right away because the stem cells will die if they're not iced. Okay. So this is going to be the third spin that we're going to do for the PRP. And after this, basically, we're going to mix it with the stem cells, and we're going to go from there. Okay, PRP with stem cell. This is the gold right here, guys. Now we're going to inject it. Okay, bring your head. So the area we're going to focus basically is right here. So, how does it feel?
I can hardly feel it.
You can hardly feel it. Here we go. Guys, this is the whole point of doing the numbing initially in a circle fashion. Now, if you see, I'm injecting this in a very controlled fashion. It's a very systematic way of injecting. The theory was years ago that you just do all this sporadic hits. You're jamming the patient's scalp with it, and we all used to do that, but I think that way you also lose a lot of the stem cells. You could tell he's barely bleeding. He's doing great. Okay, he's barely feeling it. Again, the key is to be systematic injections. See, I'm very systematic. My needle is perpendicular to the scalp. Doing okay?
Yeah, I think
A little bit. So great. Okay, I wiped it off. Doing okay?
Yeah.
We're gonna do more. Okay. Now we're gonna do a little bit in this frontal part here. So just go in there and inject it. Excellent. Now I'm gonna go to the other side and do the same thing on the other side. You're almost done.
Okay, great.
Perfect. So we're done with the stem cell injection. There's one more part to this. Please clean them up. I'm gonna be right back. This is a Derma Roller. This is actually one of the, not most important part, but it's definitely an important part of the procedure. Not a lot of doctors do it after doing a PRP stem cell, but I definitely make sure I do it. So basically what a Derma Roller is that it has, basically there's a roller and has about 540 spikes at the tip. So this is clean. What we do, we put alcohol on it just because I'm OCD. Clean it up. And we're gonna roll it, grab this for a second, onto the scalp. The whole goal is that by doing this, you're actually gonna stimulate and activate some of those platelets and growth factors from the PRP component of it, and it tends to work better. Now, he's not gonna feel this because he is all numb. Okay. So let's see. Do you feel anything?
A little bit. I just feel like,
Well, you will
there's
feel
something-
pressure, but
yeah,
you're not going to feel
pressure.
pain. Yes. Pressure is okay. I mean, you're going to feel pressure when you're numb, but you shouldn't feel pain. You doing good here?
Yeah. Thanks.
Can I have a dry 3x3, please? This is creating very small, tiny pokes in the scalp. The depth of this is about 1.5. Doing excellent. Doing okay here?
Mm-hmm.
Perfect. I'm also going to do some in the front right here where we had done the stem cell injection. So now we're done. So how was it?
It seemed pretty easy.
Pretty easy, yes. It's a lot of stuff that goes in it, but from a patient's perspective, I love the fact that it seems easy. I mean, that's great. How uncomfortable was it? How much pain did you have as we were actually doing the procedure itself?
I felt pressure, not any sharp pain because of the anesthetic.
Yeah, exactly. Yes.
It dulled any sharp pain, which is great. I could feel things were going on there.
Yes.
But in terms of pain, it'd be like a 1.
So that's great. So would you recommend the process to your friends and other people?
Yeah, absolutely.
Perfect, great. So we're gonna wait about 3 to 4 months to see the final optimal results, and basically we're gonna go from there. You barely bled, you did really good. Nobody even knows basically you had the procedure done as you're leaving the office. That's exactly how we want it basically to be. So look, buddy, you did great. Any questions, let us know, and we're gonna post our photos in a few months, and we're gonna see how he does.
Okay, thank you
Great,
so much.
you're very welcome.